guys, welcome back to the BVDUMC Quizzing Society YouTube channel. I am Susmita Gokhale, the Vice President of the BVDUMC Quizzing Society. So today we'll be continuing with the Pathology Snippet 12, which is on the topic embolism. So we'll be looking at a few MCQs that have been previously asked in competitive exams to test our knowledge on embolisms. So before the MCQs, I'll request you all to pause the videos after I'll show the question and try to solve them on your own and then see the answers. So firstly, this is the MCQ 1. As we have learned in the previous snippets, we'll first read the last line of the question. So the last line of the question is, which of the following markers will be increased in this patient? Option A, IL-2. Option B, fibrinogen. Option C, BNP. Option D, both B and C. So question, now we'll take out what the important points are. So in this, the important points are that the patient has sharp pleuritic pain and dyspnea. So from this, we'll given the patient's presentation and history, the most likely condition that she'll be experiencing is a pulmonary embolism, especially considering her long haul flight and sedentary lifestyle and use of oral contraceptives. So all these things increase her risk for deep vein thrombosis and thereby increase the risk of pulmonary embolism. In case of a pulmonary embolism, usually several markers which can be elevated are fibrinogen, which is an acute phase reactive protein, BNP. This is often elevated in heart failure, but it can also be increased in conditions that strain the heart, which include a pulmonary embolism. Given this, both fibrogen and BNP can be elevated in a patient with pulmonary embolism. Thus, the correct answer will be both B and C. Now, moving on. Yes, the answer is D, which was both B and C. So now we'll move on to the next MCQ, which is MCQ 2. So as we said earlier, we'll read the last line of the question. Which is the most likely diagnosis? Option A, amniotic fluid embolism. Option B, air embolism. Option C, fat embolism. Option D, systemic thromboembolism. From this, I get to know that this question has been taken from the topic of embolisms. So now we'll take out the important points from this question. She had sudden dyspnea and cyanosis along with hypertension. And she also suffers a generalized seizure followed by coma. So all this is highly suggestive of a, and the patient had an uncomplicated pregnancy. So all of this suggests an amniotic fluid embolism. But an amniotic fluid embolism is a rare and a serious condition that can occur shortly after labor and delivery. It occurs due to the entry of amniotic fluid into the maternal circulation. And it is characterized by all the symptoms that this. The other options can be considered in different clinical contexts, like air embolism, which it generally presents with cardiovascular and respiratory symptoms, and it is less commonly associated with severe multisystemic involvement, as seen in an amniotic fluid embolism. Next, we have fat embolism, and fat embolism has a history of trauma to the bones and rupture of the bone marrow or an intramedullary instrumentation. This patient does not show such history. Hence, we'll rule out this option. Then we have the systemic thromboembolism, which can usually occur due to blood clots dislodging and traveling to distant sites, but it would be more commonly present with symptoms specific to the organs it affects. Hence, we'll rule out option D as well. Thus, the most appropriate option according to me is option A, which is amniotic fluid embolism. Now, let us go to the answer of this question. Yes, the answer is A, which was amniotic fluid embolism. I hope you had paused the video before seeing the answer. Now we have question 3. So in this, we'll again read the last line of the question, which is which stain is used to visualize the histopathological tissue. So option A is Von Cosa, option B is Sudan black, option C is oil red O, and option D is both. So from this, I have to have the knowledge of different stains that are used in pathology. Now we'll take out the important points from this question. So the important points are that the patient has suffered multiple fractures. So the bones marrow, and later he shows symptoms of an embolism, which are pulmonary insufficiency and neurological symptoms and anemia and thrombocytopenia. So, as we discussed in the earlier snippet, these symptoms are suggestive of a fat embolism syndrome. Hence, we'll have to know which stains can be used to detect fat globules in the vessels. So, the correct option, according to me, will be Sudan black B and option C, oil red O. So, both of them are the appropriate stains which are usually used to globules inside the blood vessels or anywhere. So, according to me, the most appropriate option for this question is option D, both B and C. Now we look at the answer, which is D. Hence, I hope this video has helped you. And for more such content, you can subscribe to our YouTube channel, which is BBDOMC Quizzing Society. And if you have any doubts regarding embolism or regarding this video, you can post it in the comments below, or you can even email it to us, quizzing society@gmail.com. Thank you.